UW360 is proudly supported by BECU, a not-for-profit member-owned credit union. Pacific Office Automation, copy, print, workflow, and IT. Problem solved.
Professional or amateur, all sports carry the risk of injury. As Husky team physician for football and the women's basketball squad, Dr. Kim Harmon knows this all too well. She sees injuries sideline athletic careers and even everyday life for patients like Lori Henry.
Sleeping was hard, sitting was really difficult, getting up, walking. I was to the point where I could hardly walk my dog.
Hey, Lori.
Hey, Dr. Harmon.
So Lori's a former World Cup soccer player, and she has arthritis in her knee.
I was captain of the U.S. Women's National Team. Fortunate enough to play in the very first Women's World Cup in '91 over in China, and we won that. We beat Norway 1-0. It was just the highlight of my career without a doubt.
Nice. But after the glory days, Lori's body presented her with a bill.
I have a traumatic arthritis from playing. And when I stopped playing and I was coaching, my knees just started really hurting. I have tried everything. I've tried physical therapy, cortisone shots, ortho-vis shots. I've had 6 knee surgeries.
Next step for Lori, total knee replacements. But at 47, she's considered young for the surgery. Lori's at UW's Sports Medicine Clinic looking for a medical miracle. That miracle could be a therapy called platelet-rich plasma, or PRP.
What platelet-rich plasma is we take out some blood, we spin it down, we take just the platelets out. And what platelets are is, we think of them as like little packets of growth factors. And so we take those growth factors out, and we put them back into bad parts of the body and try and restart the body's own healing potential, or sometimes a pop.
But will it work for Lori? PRP is still relatively new in the treatment of arthritis.
She's somebody that's ready for a knee replacement. What we'd really like to do is see people much, much earlier than her that are early arthritis, that hopefully we could prevent them from getting to her stage.
The majority of patients Dr. Harmon treats with PRP have tendinopathy, an acute tendon injury usually caused by overuse.
They've tried cortisone injections, they've tried acupuncture, they've tried massage, and nothing has really worked. And so by the time they get to our clinic, they're pretty desperate. Our results have shown that we have about a 70% success rate. And so at 6 months, 70% of people will be mostly or completely better. This is the red blood cells and the white blood cells down here.
And because the patient is injected with platelet-rich plasma from their own blood, there are virtually no side effects.
You're using the body's own power to heal itself.
And so far, that healing power is working wonders for Lori.
This was the golden ticket. I've had 2 rounds so far. Within a week of my last procedure, I was walking 1.5 miles, pain-free. I can use this procedure just to hold off the inevitable, which is getting my knees replaced. And I know that's down the road, but this gave me my life back.
Lori is just one success story. A new pilot study is showing that PRP is improving the lives of many suffering from arthritis.
And typically in somebody with arthritis, you'd see progressive wearing away of the cartilage. And in the people who had the PRP, there was no wearing away of the cartilage.
So when's your game?
Platelet-rich plasma therapy allows Lori to resume a very active lifestyle.
I'm a teacher in a middle school, so I'm on my feet all day. I teach health and fitness. I teach before school. I coach 3 seasons during the year. It was a godsend for me. It really did work. So, okay, let's have you shoot.
But what's really great is seeing people who don't expect to get better, get better.
Oh, that was your best one.